Thanks, everybody. We have been moving more towards iGels. There's been enough research out there that our supraglottic devices seem to be favoring iGels. Why? Some articles demonstrate higher survivability when only we're comparing supraglottic devices. However, our choice still is first pass intubation. Otherwise, our rescue devices, referring to our supraglottic devices, we are moving in favor of iGel. They're easier, there's nothing to blow up, and I hope that this demonstration shows you just how easy the iGel is. You're going to have sizes of iGel from infant all the way up to adult, but the three that we generally see in the squads for our adults are the yellow, the green, and the orange. The yellow, or number 3, is for your small adult, the green for your medium adult, number 4, and the orange for your large adult. So that's just a nice way that a friend of mine, Scott Wildenheim, likes to refer to it. Small adult, medium adult, large adult. I love that. The actual numbers, the number 3 is for 30 to 60 kilos. The number 4 is for 50 to 90 kilos, so there is some overlap. And the number 5 is for 90 kilos or greater. Basically, just look at your patient and realize what you're looking at. Our mannequin right here should be considered a small adult, and when we tried the yellow iGel, it worked perfectly. So we will be talking about how to place the iGels. Let's do some comparisons to what the iGel is really imitating, and that is the old-fashioned LMAs. These are still in use. They just have to be blown up. They have to be positioned. There's some really nice processes in the iGel. So let's take our small adult iGel and just take a peek at it. It has some really nice pieces. For example, it has a built-in bite block, and all sizes have this. So if the patient does bite against this, it won't break it. It has a port that actually can fit an NG tube. And actually in the adult iGels, you can fit 14s. Smaller ones, obviously 12s and 10s, but that's still a pretty decent size NG tube. When you put the NG feeding type tube in, you simply lubricate that hole, put the tube in, and slide it up and down so it lubricates, and then push it down, and the port comes out the inferior portion of the actual iGel face, and that can then be advanced into the esophagus and stomach and actually decompress. So if you're having some trouble ventilating, you know you're in the right position, the stomach is distended, go ahead and utilize that. The other thing that this port really does, it's really nice, it warns you. You know, I was a paramedic before I was an emergency physician many, many years ago, and you just kind of watch their EOAs and various other tubes kind of spread emesis all over you. These are nice. You get an advance warning because you'll see the emesis start climbing up the column. That would be a great time to get your NG tube out and decompress that patient. Just another nice feature of the iGel. You've got your bite block, you've got your NG port, you have a surface area that is malleable and seems to form nicely. Again, none of our supraglottic devices are definitive airways, but for a transient airway to rescue you and help the patient, this is an excellent device. They all come in certain packs, and these packs for EMS can also have a strap built into it. That's the rescue pack is what that is, and it has the SurgiLube all built into it. Some of the other models may just have just the iGel, and you'll have to have your tape or device to hold it. There's different devices you can use. The Thomas endotracheal tube holder is actually not big enough, the port, to hold an iGel. You'll notice that this is a standard one because the original one has a white screw on it. The Select Thomas tube holder has a yellow screw, and you can see the shape of this will actually nicely hold an iGel. That's one way to actually secure the iGel is with the Thomas tube holder, the select one. You can also simply tape the tube and cross the tape and put the tape on each maxillary region, and that holds pretty well. I really like the rubber band that comes with the rescue pack because it's got an iGel that's slightly different than this. It's actually the same iGel, but there's shoulders on it, and so the strap just kind of straps around the neck, and as long as you just have some minor tension on it, it'll hold it in place very nicely without any harm to the patient. So those are the options that you'll get when you pull them out of the pack. Whichever one you have, you can see this nice little dimple in the pack. All you have to do is take a little Surgy lube and put it right in that dimple. You want to kind of focus on the edges and the back. And you can put a little on the edges anteriorly, but avoid any kind of Surgy lube getting into the port. So I'm going to get the back nice and lubricated, get the edges nice and lubricated, and maybe just a little on the anterior without getting anything in that anterior port. The position to place the iGel, which trained EMT paramedic can place in less than 5 seconds, is to have the patient in a nice sniffing position. You don't have to put your fingers in the mouth. You don't have to put a bite block in. All you have to do is gently press on the chin. So I'm in the sniffing position, and I gently press on the chin. That's all there is to it. As you push down on the chin, and this gentleman is actually a lot stiffer than a human. As you press gently on the chin, you take the posterior piece and you press it against the hard palate. It is curved right out of the box in the perfect position that you want it in. If you see the little edge right here, this flap holds the epiglottis up, so you don't have the epiglottis folding over onto the cords. That's a really nice piece that you won't get with a standard LMA, which is a little more difficult to place. This is like a nice little foolproof little tab to keep that epiglottis up and out once it seats. So I'm going to press gently on my sniffing position, and I'm going to press gently on the chin. I will put the posterior piece against the hard palate and just easily advance. And you advance until you meet resistance. You don't have to push any harder than that. Once you meet resistance, you want to make sure you're in. So capnography is required just like it would be for an endotracheal tube. So you place your capnography monitor, CO2 monitor. You have your ambu bag ready. And of course, this is just our mannequin, but it felt like it seated pretty nicely. So we have nice chest rise and fall with our iGel. I made that a lot longer than it needed to be because you can place this in 5 seconds. You got a nice chest rise and fall. You got capnography reading. Your patient's doing great. So we can use our select Thomas tube holder, or we can simply tape it, keep it in place, end-tidal CO2 monitored all the way to the hospital, and you have successfully utilized a very easy iGel supraglottic device. I hope that helps.